All right. Let's talk about it. Chapter 14, this is, of course, the last chapter in this course, okay? Homeostasis, right? We talked about that in chapter 1 and multiple times since then. Homeostasis is the stability of our internal environment depends largely on the autonomic nervous system, the system of motor neurons that innervates the smooth and cardiac muscle and the glands. Let's talk about that, right? The autonomic nervous system. It controls heart rate, up or down, breathing, up or down, digestion, right? Digest our food, turn the digestion off. Go into the bathroom, sex, all of that stuff, autonomic nervous system, okay? Again, I always call it the automatic nervous system, things we don't have to think about, right? Autonomic means self-governing, right? Self-governing, yes? It does it automatically. We don't have to think about it, okay? The autonomic nervous system shunts blood to needy areas, okay? When I am running a 5K, I need the blood to go to where? Muscles, right? But when I just ate 5 pieces of pizza, I need the blood to go where? To my gut, right? So the autonomic nervous system determines where that blood's going to be. Oh, by the way, if I eat 5 pieces of pizza and then I run a 5K, am I going to digest my food? No. It'll do that later, right? After I run the 5K, then it'll digest my food when I'm laying on the couch, right? Yes? Okay? So the autonomic nervous system does all these amazing things for us. It goes to smooth muscle, the cardiac muscle, and it goes to our glands, right? Yes, those stomach secretions. Those secretions from the pancreas, right? All of those things that help us digest our food. Yes? Okay. It's the involuntary nervous system, okay? Now, remember too, we're talking autonomic. We also talked about somatic, right? But somatic, soma means body, right? That's to all your muscles and all of that good stuff, right? But autonomic is to, yes, your smooth muscle of your gut and your heart and all those glands, right? But somatic, most of somatic is under our control. I decide if I'm going to get up, walk over here, sit down, or do what, right? But I don't decide when I'm going to digest my food, okay? That's partially true statement, not totally, but anyway, okay? So let's talk about that. The autonomic nervous system, yes? And again, we talked about autonomic nervous system. Oh, this is I forgot to write this word down. Okay? The autonomic nervous system, we split it into 2 parts. And the 2 parts are parasympathetic and sympathetic, right? And parasympathetic is rest, relax, digest. Some people say feed and breathe, right? Parasympathetic, right? Sympathetic is run, jump, stress, fight or flight. Fight, flight, or freeze, right? Sympathetic is getting us ready for battle, right? When we get stressed out, we're in a sympathetic state, yes? If you're really stressed and you eat a big meal, are you going to digest your food good? No, you're not. No. But if you're calm and you're relaxed and you're having a good time, yes, and you're having a lovely dinner, right? For me, with the gorgeous woman, yes, and we're going back to the hotel afterwards, that's parasympathetic. But sympathetic, I'm running that 5K and I'm trying to beat that old guy, right? Yes? So, the autonomic nervous system, parasympathetic and sympathetic, yes? And let me explain, again, that's a picture from your book. You can look at it. They put them both. There's better pictures, 1 or 2 pages back, they show only sympathetic and only parasympathetic. But this is the diagram of both of them, okay? And so, basically what this is very simple. This is a wiring diagram. This is how the nerves run, okay? This is a wiring diagram for the parasympathetic nerves and for the sympathetic nerves, okay? So, let's start if you would, parasympathetic, right? Parasympathetic. Okay, let's start on that side. Yes? Parasympathetic is also called the craniosacral. It's called the craniosacral because look, your cranial nerves come out where? Of the cranium, way up here, right? And your sacrum is a triangular nerve down here, so you have a few down here too. So it's called craniosacral, all right? Parasympathetic nerves, parasympathetic system, craniosacral, okay? Now, let's talk about it. Remember we just talked about the cranial nerves and the eye movers, or number 3, oculomotor, number 4, trochlear, number 6, abducens, right? Yes? And they're cranial nerves, so they come out the bottom of the brain and they control the eye, right? The movement of the eye, okay? So, again, what is parasympathetic going to do to the pupil of the eye? It's going to be pupillary. Pupillary what? Constriction or dilation?
Constriction.
Constriction. Right? When the parasympathetic goes up, our pupils are going to get smaller because we're laying on the couch, relaxing, reading a book. Okay? Right? Now, I mentioned that because I'm going to ask you, what does a parasympathetic nerve supply to the heart do? And you're going to tell me it slows it down. But anyway, we're not there yet. But that's why I'm saying that. Pupillary constriction, right? Now, to the salivary glands, yes? Right? Have you ever, oh man, smell that meal and mom's putting it on the table and your mouth starts watering, right? So what's going to happen to your salivary? I couldn't draw a very good picture of a salivary gland. I'm not sure y'all would know what that was. But anyway, what's that going to do? Parasympathetic nerve supply to the salivary glands. What's it going to do? Increase or decrease saliva? Increase saliva, right? Does that make sense? You're ready to eat, your mouth starts watering. Yum. Okay? Now, here we go. Here we go. Notice the X here, but actually it's not an X, it's a Roman numeral 10. 10 for Vegas, baby. Right? Vegas. Yes? The only cranial nerve that goes below the neck is the what? Vagus, right? The vagus nerve, guess what? It comes from below your skull to your heart, to your lungs, to your stomach, to your pancreas, liver and gallbladder, right? All of that is vagus. Vagus, if you hadn't figured out, is a very, very important nerve, okay? Vagus, cranial nerve, yes? So, it's going to come down to the heart. What's parasympathetic to the heart going to do to the heart rate? Decrease heart rate, right? Yes, because you're laying on the couch relaxing. Okay? To the lungs. What's it going to do to the lungs? To the breathing tube, more specifically to the bronchi. Are they going to get big? Are they going to get small? Okay? If I'm laying on the couch, do I need my breathing tubes to be really big? No, I need them, they're probably going to get smaller, right? So, decrease, how should I say that, size of the breathing tubes. Bronchoconstriction. Bronchoconstriction, right? Now, when we talk about sympathetic, if I'm running, they better get big. That's sympathetic. But if I'm laying on the couch, I don't need all that air in and out, so they're going to get small, right? To the stomach. What's parasympathetic to the stomach going to do? Is it going to increase the digestive juices and digest my food? Or is it going to turn all that off? Decrease it. Right? Remember, feed and breathe, rest and digest, right? So increased the stomach secretion, right? Okay. To the pancreas, what's it going to do to the pancreas? Is it going to up or down the secretions from the pancreas? It's going to increase, right? Because I may have eaten a bunch of carbs, so I'm going to need some insulin, right, to lower the carbs, yes? And my stomach's full of acid. As soon as that chyme comes out of my stomach and into the small intestine, right, is super acid. And the pancreas takes care of that by dumping out a bunch of bicarb. The bicarb's going to go up to neutralize that acid, right? So the secretions are going to go up. To the liver, the gallbladder, right? Increased secretion, right? Okay. The bladder, okay? Parasympathetic is going to be urination. Have you ever been so stressed out you couldn't pee? Right? Okay. Now, there's one other down here. Genitals, okay? Genitals, right? Parasympathetic nerve supply to the genitals is going to make men get an erection, and it's going to make the ladies, right? The homologue to the men's penis is the clitoris in the ladies, so blood's going to flow there on the ladies, and spasms of the vagina. So, parasympathetic, right? So, that's going to help the man get an erection. It's going to help the lady get ready for sex, okay? Parasympathetic, right? When men are super stressed out, ladies have a hard time getting it up. Sorry, I don't mean to be crude, but I don't know another way to say it, right? Because that's what happens if they're totally stressed out, right? Yes? By the way, ladies, unless you want a divorce, don't ever make fun of your husband. That happens to him, unless you want a divorce. Hey, if I'm lying, I'm dying, right? Anyway, parasympathetic, right? Parasympathetic. You're grown-ups, I'm talking like grown-ups, okay? Right? I'm not being crude. I'm just saying what happens, okay? Anyway, right? Here we go. So, this is the parasympathetic side of the autonomic nervous system. It is craniosacral. But now, I need to mention something. Remember we talked about here's a nerve, and here's another one, right? And here's the synapse, S-Y-N-A-P-S-E, or synapse if you're British, right? Yes? And this one is called the presynaptic. And this is the postsynaptic, right? Does that make sense? The signal's going that way. This is the presynaptic, that is the postsynaptic. Okay? But they will synapse in a ganglion, G-A-N-G-L-I-O-N, right? They will synapse in a ganglion, right? And so we're going to call this preganglionic, and this is going to be the postganglionic. Remember, ganglion means not on a string, right? A lot of the cell bodies of nerves are going to be in particular ganglions, right? Now, the reason I mention that is one of the hallmarks is, let's say, way down here to the stomach, right? One of the hallmarks of parasympathetic is, right, the axon coming out of the brain, right, is going to come way down here to the stomach, and usually it's going to synapse in a ganglion that is just on the outside or the outer wall of the stomach, and then it's going to innervate the stomach. This one right here Coming out of the brain is the preganglionic, and this one right here is the postganglionic, right? So, if I do it here to the liver, right? The preganglionic, right? Then it synapses and goes to the gallbladder and the liver, and this little short one is the postganglionic. Yes? Do you not like my artwork, Joseph?
I just thought
It's okay, I'm just harassing you. It's no big deal, right? The postganglionic, notice, coming out of the brain way down here to my liver and my gallbladder is long, and this one is short. The hallmark of craniosacral parasympathetic is long preganglionics and short postganglionics, right? That is a hallmark of craniosacral, right? Because the first nerve in the chain is long and the second nerve is usually very short. Long pre, then it synapses in the ganglion, and short postganglionics. And why that's important, it's going to be the opposite in sympathetic. We're going to talk about in just a moment, right? Okay? Anyway, right? Craniosacral, where do the nerves come from? The cranium, the cranial nerves, and way down low here in the sacral. Okay? Craniosacral branch. Parasympathetic. Okay? This is rest, digest. Some people say feed and breathe. Okay? Right? Craniosacral, known for long preganglionics and short postganglionics. Right? And you need to know, parasympathetic to the eye, to the pupil is going to cause vasoconstriction. Parasympathetic to the salivary glands are going to cause increased saliva. Parasympathetic to the heart is going to decrease the heart rate. Right? The heart is dominated, by the way, we'll learn in the next half, the heart is dominated by parasympathetics. Okay? And when the parasympathetic nerve, if you cut the vagus nerve, guess what happened to the heart rate? Boom, it'll skyrocket. But anyway, bronchoconstriction. Parasympathetic to the lungs, those breathing tubes get small because I'm laying on the couch. I'm not running a race, I'm laying on the couch, right? So the breathing tubes can be small. Yes? To the stomach, right? Rest and digest. I'm going to digest my food. Secretions are going to go up. Stomach, pancreas, liver, gallbladder, all of that, right? All of that is going to be stimulated because I'm digesting my food. And again, to the genitals, right? It's going to cause erection in the men and erection of the clitoris in the female, the homolog, right? Okay? Now, let's flip over to the sympathetic, right? Sympathetic, right? It's fight, flight. Some people say, too, it's very common among mammals, we freeze, right? Yes? I'm like 12 years old. The first time I got to ride a motorcycle, I got on and I did that, and I hit the throttle, and it took off through the yard, through the street, and into the neighbor's bushes. I just froze. It's very common. If you look at the Olympic bombing in Atlanta, kaboom, the big explosion, and a bunch of people just do this and just freeze. It's a common mammalian response, right? So that's why they say fight, flight, sometimes freeze, right? Not a good idea to freeze. Most of the time you want to get out of there, but anyway, yes? Okay. Now, thoracolumbar, yes? T1, LT, L2, right? T1, L2, about here to here, yes? Do you remember? Oh, by the way, we talked about the spinal cord, and it's shaped like that, right? And the gray matter looks like a butterfly. But oh, by the way, in the thoracics, it looks like what? You got your lateral horn, right? You got your ventral and your dorsal horn above and below it. But in the thoracics right here, what do you got? You got your lateral horn. Yes? Right? Remember, where's all your guts? From here to there. Right? Remember sympathetic in the back? Pardon me. Afferent in, efferent out. But anyway, right? Sensory to the back, motor to the front, I'm saying. Right? But anyway, notice T1 to L2. Again, these are all approximate, but anyway, right? That's going to be modulated through the lateral horn, not the ventral or the dorsal, the lateral horn, right? Okay? And what happens is, on each side of your spine, starting at about, this is T1, starting about here, on each side you have a sympathetic trunk, and it goes down to about here. It's a little bitty nerve. Okay, you know a ballpoint pen, if you pull the pen out, and it's got the little point on it, and it's got the little tube, it's a little bigger than that tube, right? On each side of your spine, T1 to L2, right? You have that nerve on each side, yes? And so, I only drew it on one side because if I drew it on both, it'd be confusing. But it's on both sides, right? Yes? And so what happens is this. Your preganglionic will come out of the spinal cord and go synapse in that sympathetic trunk. Sympathetic trunk. Just one second. There's about 3 different names for this. I'll think of the other names in just a moment. I generally call it the sympathetic trunk, right? Okay. But anyway, so nerve will come out of the spinal cord. It will synapse. This is a big megaganglion, by the way, is what this is. It's a ganglion, basically, right? And so sympathetic to the eye, right? The nerve will come out. It will synapse in the thoracic trunk and go to the eye. And sympathetic to the eye is going to cause pupillary what? Dilation. Dilation, right? Pupillary dilation. Yes? Now, the same thing, out of the spinal cord, into the thoracic trunk, right? Or the sympathetic trunk or the thoracic trunk, whatever, okay? And to the salivary glands, yes? Let me ask you this. Have you ever had to give a speech in front of tons of people and stand up there in front of tons of people and give a speech? Yes? What happens to your mouth? It gets dry, right? So, decrease saliva, right? Right? Because this is a stress one. This is fight or flight. This is decreased saliva. Okay? Now, to the lungs. What's going to happen to the breathing tubes?
Increase.
Okay, how about broncho? You're correct. Dilation. D-I-L-A-T-I-O-N. If I'm running, I want those breathing tubes to be big so I can get a lot of air in, so I can blow a lot of air out, right? So I can win the race. Yes? Okay? Bronchodilation. To my heart. What's sympathetic to the heart rate going to do? What's it going to do?
Go up.
Up. Increase heart rate. Yes? Again, make sure you know these because there may be a question or two. Okay? To the stomach. Right? Now, notice the way I drew this one. The stomach, the pancreas, the liver, there are some ganglions The nerve will go through the sympathetic trunk, but technically there are some ganglions in your abdomen where they will synapse, not in the trunk. And they draw those in the diagram you can see, but it's very close to the trunk. That's why when you do abdominal surgery, you need to be very careful, because if you hit one of those, that wouldn't be good, right? It wouldn't be good at all. But anyway, okay? But decreased secretion, right, to the stomach. You're not going to digest your food when you're running that race. To the gallbladder, the pancreas, this. It's all going to be decreased secretion. Liver, I could not think of that for the life of me. S-E-C-R-E-T-I-O-N, right? Yes? Oh, by the way, what's it going to do to the adrenal glands? Right? Adrenals send out epinephrine and norepinephrine, right? Those are the stress chemicals, right? Right? My adrenaline goes up, you know? You go walking in the front door of that haunted house and then they jump out, grab you, right? Adrenaline goes up. So increase epinephrine and norepinephrine, right? Secretion, will increase secretion. Right? Now, to the bladder. Decrease to the bladder, right? It's not good if you're running that 5K, excuse me, I have to pee, right? Yes? Wouldn't be good, yes? So, sympathetic stimulation goes down. Right? Remember, parasympathetic, you go pee. Sympathetic, it kind of turns that off. Right? Have you ever been in a stressful situation for several hours, and then when it's over, you pass the test, and you're walking out there, you're like, oh man, I gotta go. Right? But anyway, okay, here we go. Through the sympathetic trunk to the genitals, right? What's that going to do? Yes? Okay, what happens is this. Many times we think, oh, parasympathetic or sympathetic, but we don't realize that the two work together. It's a balance. In certain situations, I need big breathing tubes. In other situations, I need little breathing tubes, right? So it goes back and forth. So the two work together, right? And sex is an example of that. Parasympathetic, calm, relax, you got the romantic music on, blah, 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 right? Yes. And that causes erection of the penis and the clitoris. However, ejaculation is sympathetic, right? So this is where the buildup is parasympathetic and orgasm is sympathetic, right? So this is an example of where the two work together to accomplish the goal, okay? Right? Forgive me if I was too crude, but anyway, yes? That's the way it works. They work together. And like I said, yes? Too much stress, this ain't happening, right? Too much stress, right? Yes? Okay. Now, notice, the sympathetic trunk is about this far on each side of your spine. So the hallmark of the sympathetic is short preganglionics and long ganglionics, right? Just the opposite, right? Just the opposite, okay? Because from here to here is short, from here to here is longer, right? And so that is the hallmark, okay? Make sure you understand that. Parasympathetic, it's coming from the cranial nerves, and you got a long nerve, then a short nerve. But sympathetic, you got that sympathetic chain right down the side of your spine. It comes out of your spinal cord to that sympathetic chain, and then it goes a long way to whatever organ. So it's sympathetic is short, long. Parasympathetic is long, short. Okay? Right? Does that make sense? And again, T1 to L2, right? T1 to L2. Yes. And that's why this is called thoracolumbar. Lumbar because it goes down to L2, L1 and L2, right? About the end of the spinal cord. Yes? T1, thoracolumbar. Right? Yes? Does that make sense? Yes? It's just a wiring diagram, that's all it is. And note 2, of course. Note 2, of course, that one of these on each side. Okay? One of these on each side. Yes? Right? And note 2, of course, anyway. Yep. After you get the gist of it, it's really not that complicated. Okay? Okay. Let me make sure, let me go over this. Okay. Parasympathetic, rest and digest, housekeeping, maintenance, elimination, going to the bathroom, right? Conserves body energy, yes? Sympathetic, fight or flight. It mobilizes the body during activity. You get the pounding heart and the cold, and the pounding heart and sweating and a dry mouth and dilated pupils and vigorous activity. It shunts blood to the muscles and the bronchioles get big for more oxygen delivery. The liver gets more glucose and your GI tract, your stomach, all that junk goes down, okay? Okay, and we already talked about they work together. Okay. Now, we talked about neurotransmitters, right? Remember the neural end plate, here's the end of the nerve, here's the muscle cell or the nerve cell, and, right, you got your acetylcholine, ACH, acetylcholine, right? That's a neurotransmitter. The neurotransmitter in the somatic nervous system, right? But there's a bunch of different neurotransmitters, okay? That's where it gets a little bit complicated. But we're going to talk about two different ones. Basically, cholinergic, 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 and adrenergic, adrenergic. Okay? Cholinergic, those are nerves, mainly somatic, but also the start up here, the sympathetic system runs on acetylcholine. Okay? It's called cholinergic for the choline in the acetylcholine, right? Yes? And most of the time it's stimulatory. Okay? However, in the sympathetic system, the pre-ganglionic, the first one is acetylcholine, okay, and the post one is going to be norepinephrine, and another word for norepinephrine is noradrenaline. Hence the adrenergic for adrenaline, adrenergic, okay? And this is going to be your parasympathetic, pre and post, and this is going to be your sympathetic post, because the pre is cholinergic, response to acetylcholine. Okay. All right. The reason I mention that is this. Okay, or let's talk a little bit more. The cholinergic. There are two types of cholinergic receptors. One is called nicotinic, and the other is muscarinic. Muscarinic, okay, right? Nicotinic. What does that sound like, people? Nicotine. Guess what? Nicotine stimulates these receptors, right? So, oh my God, I'm stressed out. I need to go outside and do what? Smoke a cigarette. Yes. Okay. So that's where we get the name for the nicotinic ones. They are stimulated also by nicotine. So when you smoke a cigarette, you're stimulating these, and guess what? It's parasympathetic, which is calm me down, right? Now, muscarinic. Now, we don't know much about that around here, but if you live in Appalachia in the eastern United States, you might. People go mushroom hunting, right? And why they go mushroom hunting? Well, some people eat them, but right, what they do is if you get the right kind of mushrooms, you ever heard of magic mushrooms, right? Guess what? You make mushroom tea, and what does it do? Psychedelic, right? And if you get too much, you kill yourself. Yes. Okay. That's called muscarinic. Muscarinic. That's the magic mushrooms, right? And if you get too much, guess what? Your digestive system will be turned on and you'll be having diarrhea in your pants because you are on a trip, right? Okay? Muscarinic, nicotinic, right? Those two are called cholinergic, right? Adrenergics for adrenaline, right? And remember, another word for adrenaline is epinephrine and norepinephrine, okay? Epi and norepi, right? And there's a bunch of different ones of these. Let me see. There are certain ones called alpha 1 and 2, and then there's a beta 1, 2, 3, 1, 2, 3. Okay. Technically, actually, there's more than that. But anyway, why do I mention that? I mention that because of people that have asthma, right? What happens to their bronchioles? They get real small. You can hear them wheeze. They can't get enough air in and out, right? So they search for a drug that would make them get bigger, right? And that's parasympathetic. So they look for a drug that did that. However, if you stimulate, let me look, I think it's beta 2. Yeah, beta 2, okay? So you don't have to know beta 2, but I'm just saying, if you stimulate the beta 2, right, then that is bronchodilation. That's what we want. We want their bronchioles to be dilated so they can breathe better, right? But the other problem is, oh, by the way, if that drug stimulates beta 1, guess what happens to their heart rate? Boom, 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 boom. We don't want that, right? We want their breathing tubes to get big, and we want their heart rate to stay the same, right? And so the big deal was when they found something, medication that would make those breathing tubes big but not affect the heart. That's why, okay? And there's a bunch of, like I said, there's a bunch of different ones, and I'm not an expert on that, okay? But anyway, that's a big deal about it. They were able to treat asthma much better and save more people's lives when, right? You heard of rescue inhaler, right? Yes? Can't breathe. Rescue inhaler, right? And those breathing tubes get bigger, but again, we don't want a pounding heartbeat. Yes? Right? Over the counter, you used to could get ephedra over the counter, right? And it would dry you up. It's a sympathomimetic. It would dry you up, but it'd make your heart go boom, 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 and shoot your blood pressure up. And some idiot kids were drinking a bunch of Monster, right? and taking ephedra at the same time because it covered up when they were drinking too much alcohol. Because supposedly, if you drink the monster drinks or the drinks with a high caffeine and such, that will cover up the effects of drinking a lot of alcohol. Okay, so you and such, right? My buddy I ride motorcycles with. When we ride motorcycles, we never drink, ever. But when we get to the hotel at night and we rode that motorcycle for 12 hours, yes, I've seen the Red Bull come out in the little bottles of vodka, okay? Now, I don't care for vodka, but my partner, he does, right? And we're stopped and we're not riding those motorcycles anymore, and I don't care. Or if we're camping outside, we've stopped at the convenience store and they get the 6-pack, right? Yes. Then I get up in the morning, there's beer cans all over the ground that they pick up. Yeah. But anyway, so, right? As long as we're stopped, that doesn't bother me in the least. Yes, I'm not doing that. I learned my lesson on that. On one trip, it was hot and sweaty. We rode like 10, 12 hours. It was really fun. Had a great day. And I pulled out a big cigar and I drank 2 of them little things of Fireball. And the next morning, oh my God, the headache. Oh, the headache, right? Because I've been sweating, dehydrated all day long, and that's where that comes from. But anyway, so, hey, I don't know how I got off on that, sorry. But, right? So, if you hear cholinergic, that means acetylcholine, right? That's going to be your parasympathetic nerves. If you hear adrenergic, those are the ones, usually the second, not the pre, but the postganglionic, used, actually it's noradrenaline. Norepinephrine, norepi, right? And we'll talk more about that in the next half of this course, okay? Okay? Now, quickly, let's talk about sympathetic tone. Sympathetic tone, okay? What in the heck does that mean? Right? We talked about muscle tone. The muscles are contracted a little bit all the time, right? If they weren't, then I'd be jelly and I'd fall on the ground, yes? So, sympathetic tone, it relates to this. The heart, we will learn in the next semester, or the next session, the heart is dominated by parasympathetic. This slows it down. But the blood vessels are dominated by sympathetics. Okay? The blood vessels are dominated by sympathetics, and in the lining of all those blood vessels, you have baroreceptors, right? Baroreceptors, right? And we talked about that, right? A barometer goes, yes, and it goes back and forth, yes, depending on the pressure. Well, the baroreceptors are squeezed down or stretched out, depending on the pressure. And they send signals to the medulla, right? Right? Because we're talking autonomics here. I don't have to determine my blood pressure. I don't have to think about my blood pressure. I'm not saying, I'm going jogging, I should up my blood pressure, do I? No, it's all autonomic, right? But the blood vessels are dominated by the sympathetics, okay? And again, it sends signals to the medulla, and that controls our blood pressure. And the way it does that is this. Okay? In my blood vessel, if my blood vessel does this, gets real big and dilates, what's going to happen to the pressure? Down, right? Conversely, if my blood vessel does this, what's going to happen to the pressure? Up, right? If I have so much pressure going through a water hose, right? Let's just say 50 pounds. If I send 50 pounds of pressure through a water hose, right, this big around, can you say fireman? Right? It's not that much pressure. But if I send that same 50 pounds of pressure through a little bitty hole, tiny, right, that's a pressure washer, right? The pressure washer takes that 50 pounds of pressure and it squeezes it down through a little bitty hole, and it comes out very strong, And if you're not careful, you knock the paint off your car. Ask me how I know. But anyway, because I'm expert at driving old cars, right? Yes? Not because I have to, because I'm allergic to car payments. Because the last time I made a car payment was 1989. That's honest to God, right? Can you imagine from 1989 to 2022, no car payments? How much money that is? But anyway, so, right? Yes? So, my point being is, sympathetic tone has to do with proper blood pressure and blood pressure changes. It's very dynamic, but those baroreceptors up and down, we're going to talk much more about them in a future chapter, okay? Now, another reason I mention that is because people that become diabetic, they have trouble. They have trouble with the nerves in their feet, right? Neuropathy, thank you. Neuropathy, yes? Am I telling you something new? No, right? Yes? Here's another one. Again, not to be crude, but men that are diabetic, guess what other nerves are destroyed? Right? The vast majority of men that have bad or they've had diabetes for a long period of time, guess what? They can't get an erection. I had a guy in my office about 30 years old. He's a bad diabetic. And he says to me, I have trouble. I'm not married. I'd like to get married. I'd like to have kids someday and this and that. But I'm a bad diabetic. Can you help me? Because I can't. Frankly, he said, I can't get it up, right? And I had to say, sorry, no, that's your diabetes. I can't help that, right? Okay? So they have trouble with sympathetic tone because it destroys. High sugar destroys the nerves. Yes? Right? High sugar destroys nerves. That's what it does. It's very simple. It's very simple. But anyway, yes? So, if you don't want to destroy your nerves, really, you lower your carbohydrate intake. Yes? Right? Okay? Sympathetic tone, the major actor determining your blood pressure, even at rest. Okay, with few exceptions, the vascular system is only sympathetically innervated, and that sympathetic tone, it's always acting more or less. And another word for sympathetic tone is vasomotor tone. Because, oh, by the way, those blood vessels are smooth muscles. Okay, it's smooth muscle, and when that muscle contracts, vasoconstriction, and when that muscle relaxes, vasodilation, and blood gets, the pressure goes down, right? Okay. Okay. The diabetics get autonomic neuropathy, Neuropathy, autonomic neuropathy, right? Diabetics, right? Get autonomic neuropathy. 75% of male diabetics experience erectile dysfunction. The ladies have decreased vaginal secretions. Other symptoms, dizziness after standing suddenly, right? When you're sitting down and your blood pressure is low, and then you stand up and you start walking, your blood pressure normally is going to go up. It's normal. Blood pressure is very dynamic. It's not the same. People say, oh, 120 over 80. Oh, baloney. It goes up and down, right? Yes? Texas Tech scores a football game, scores a touchdown in the last 30 seconds. I assure you my blood pressure is going up because I'm screaming, right? Yes? It's very dynamic, okay? Urinary incontinence, right? Diabetics can become incontinent, can't control their bladder. Sluggish pupils, right? Shine a little light in the pupil, and normally it should do this, right? But if it's very slow to do that, that can be a sign of autonomic dysfunction. And decreased sweating, okay? Now, biofeedback, right? Pardon me. Biofeedback is also a way that we can influence our autonomic nervous system. Notice I said it's automatic and we don't have to think about it and it just does its thing and it knows what to do, right? But I'll tell you a story on me. I was taking a physical for life insurance, right? And my blood pressure was like 136/90. You know, the gal showed up an hour early and I had a room full of patients. And so it stressed me out and I had to get through them and then she showed up way early. And she took my blood pressure. It wasn't my blood pressure. She said, oh, it's like 136/90. I said, no. No, my blood pressure is way lower than that most of the time. You know, I said, you give me 2 minutes, right? And I sat down in the chair and I breathed slow and easy. And I said, relax. Took a few long, deep breaths. Took about 2 minutes. I said, now you take my blood pressure, 120/80, perfect, right? Because if you have high blood pressure or high blood sugar or protein in your urine, all these things, they're going to charge you more money, right? But if your height and your weight is right and your urinalysis is right and your blood pressure is great and your blood sugar is great, then guess what? You're going to get the best rate, yes? Well, who wants to pay more money for 10 or 20 years, right? Just because she showed up an hour early and I was really busy and really stressed, right? Yes? I was also worried too. I said, look, you have to put down that I weigh 160 pounds, you know, because otherwise I'll be underweight and that'll count against me, you know? She's like, oh, you know. And I was like 158 and I'm like, no, wait a minute. You know, because I want to be 160 because I didn't want to be underweight because that counted against me too, you know, and such. And after they did all that, a couple weeks later they called me and talked to me about it. So we don't have your health records. So I don't have any health records. I haven't been to the medical doctor in 20 years, you know. So I'm a chiropractor. I run, I exercise, I'm the right height and weight. You know from my numbers there. My blood sugar's great because I haven't been in 20 years, you know. But if I need to go, I'll sure go. So, you know, I don't really have any records. And the doctor I went to 20 years ago, he died. Sorry. You know, I'm like, oh, okay, that's very unusual. I'm like, sorry. But anyway, yeah. Okay. Now, what we're going to do now is we're going to do the eye lab and put an apron and some gloves on. And would be good if you cover your eyes too. I haven't ever had one come shooting out, but just in case. Okay? This will only take about 15 minutes or so, and then we'll be out here. All right? Okay. This is my last black pen. No more. It's my last one, so I gotta have some for the next. Wait, excuse me, sir. Sorry. That arm. Hey, I could get. Right here. Oh, there we go. Oh, there we go. How many do we have today? One. Wow. Let's do my back. Let's see. 2, 4, 6, 8, 10, 12, 14, 16. Let's stop secret. Thank you. Okay.
Yeah, I got it. Did it include our schedule or did it say it was done? Oh, did I not? Oh, yeah, I'll look at it.
Are you 4 ladies together? Yes? Okay. All right, take your pick.
Get us a good one.
You go voluntary.
Oh, no, I want you to sit there.
Take your pick, it's hard to roll.
Bigger
Bigger is better. Okay, grab one. Why should you be nervous? I know. They didn't shake their eyebrows. Hey, sir. Fun, fun, fun. Hey. Yeah. Is there 2, 4, 6 of y'all? You guys have one too? Sure.
Oh, here it is.
Go for it.
You didn't have to grab it. It was
There's the eyelid.
There you go.
my arm.
Hey, grab a dissecting kit over there, folks. You need the razor blade out of it.
I have juice on my hands.
Thank you. Hey, we don't want to hear about your problems, man. Come on. Bye. Okay.
Thank you so much.
All right. If you would, here's what we're gonna do. Here's what we're gonna do. Okay. Okay. We are gonna go over real quickly the anatomy of the eye again, right quick, and then we're going to open the eye up. Okay. Yes.
I didn't feel like Alexis used to put on her goggles before. So your goggles are always pretty
Okay, if I can have your attention, please. If I can have your attention, please, for just a minute, okay? Now, here's what we're going to do, right? First off, cornea, right? Y'all see the cornea, the clear, kind of opaque now, but anyway, it's clear earlier, right? The cornea, yes? Now, what we're going to do is, basically, we're going to cut the cornea off, right? Normally, you'll take the scissors and make a little snip. Or sometimes you can use the razor blade to do that. Make a little snip and then go around and cut the cornea. And when you cut it, don't do it yet, but when you cut it, then what's going to happen is the front, the liquid in the front, the anterior chamber of the eye is the aqueous humor, right? Aqua, water. The aqueous humor is going to come out. When you snip into that, that's going to come out, okay? So, you're going to take the cornea off, right? Yes? And you're going to look to see the iris, and you'll see the hole where the pupil is, right? And remember, the white is the sclera, and on the outside of the white, you have that clear epithelial tissue that secretes the mucus. That's the conjunctiva. And remember, when the conjunctiva gets irritated, you get pink eye. It's red, right? Pink. Okay? So, we're going to do that. Then, what you can do is, very carefully, take your scissors through the pupil and snip, 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 and cut back, like from, how shall I describe it? Stick your scissors, when you stick your scissors in here, your lens may come out. Sooner or later, it's going to come out, right? But anyway, you cut across here and here, and basically what we want to do is, we want that eyeball to do this, to open up into butterfly, just like that, so we can see the retina, okay? You will also note the vitreous humor, right? The vitreous humor, this thick stuff like Jell-O that you have all your life. It's kind of like clear Jell-O, like Jell-O made of Sprite almost, yes? And that's going to come out too. But again, it's very thick. It's like Jell-O, right? And then, if you do a good job, what will happen is you'll be able to see this amazing, beautiful retina. And some people take the tweezers and get a hold of that retina and pull the retina away. The retina is usually purplish to usually blue-green, okay? And so basically we want to see, right, the cornea. We want to see the white, the sclera. We want to see the anterior and the posterior chamber, right, with the aqueous and then the vitreous humor. We want to take the lens out. You can play with the lens and squeeze on it and see how hard it is, right? And such. And then we want to cut around and be very careful so we can butterfly it open like that and see the retina, right? And if we can, very gently pull the retina off in. I've seen it done many times in one piece. It's really cool. It's turquoise usually, okay? So, right? So, that's the lab. Again, you can mainly work with the scissors, but it can be that you use the razor blade also.
Gotcha. I'm taking this your eyelid off.
Okay?
Just gonna enter us on the side. You're more than welcome to.
Dr. Weld?
Yes, I was looking for razor blades.
Okay, I was listening, but I forgot the first step. What do I do first?
Okay, you gotta make a circle, cut all the way around the cornea, right?
If it's words on me,
Don't get your face too close, young lady. I mean, unless you want, eye juice on your face, right? That'd be embarrassing.
Okay, now I'm going to check the incision.
Okay, somebody made off with my
This part right here.
on my razor blade.
You want to try and check it back? Right here. It is the sharp edge. I don't want to pop it. Well, I know it is. I'll just come in. I'll pop it. Exactly.
Yeah, this part right here.
Okay. Does somebody want a razor blade?
Could we have one, please?
Okay, I got it. Yeah, we're doing it. Don't cut your wrist. Here you go. Okay. All right, now, the razor blades, make sure you wash them and dry them and give them to me, because I'm literally, my 100 package, got it? I have an answer for you.
Do you have an answer? Okay, I hope so. So I will not be here today. I have to go to Dallas.
You start over the top.
Okay, well, then what's gonna happen is that I have to turn the, I have to turn the brakes in.
I get the skizzers.
Because the next session starts on Wednesday, so on Tuesday after I turn the brakes in, you get until you take it. Don't freak out if you look on there and it says incomplete.
That's what
Are you gonna be back on
Cut
Saturday?
it?
No, not necessarily, but I didn't have to take.
Got it, girl.
I had to take the first half. I'm taking cough and then. I'm sorry, I wanted to take both. It's okay, I'll still see you in church first. I know.
No, I know, most need 8 hours of science to do it. Oh, there you go, yeah. All right.
This is grossing you all out.
Just like
Yeah, be very careful.
I don't
And
need
you're,
to see you right now.
are you?
Well, that's the eyebrows.
That's what I thought, good. Okay, guess what that is? That's the lens, here we go. Okay.
Well, I'm just trying to figure it. They're so dull, huh?
And you see that beautiful color? Guess what that is? That's your red. Right?
It don't matter how good she is, it's got
Right,
hard
you
to
see
do.
the camera, but open it up a little bit more, so you see the tweezers, right? But, here you go. The aqueous humor, the fluid in the back, the vitreous humor, the lens,
Aqueous.
the iris.
Why does this feel so long?
Okay?
Just on my hands.
No, they got the
Be a whole
paper,
minute.
right?
That's okay.
Do I cut it more, like a butterfly? Or make it easier?
You gotta cut it more, but look, okay? This is of course the cornea,
That's okay.
and the clear fluid is the aqueous, right? It's changed all the time, it's mainly water and protein. Okay, you see, there's the iris around the edge. Closer to okay? That's the iris right there. And if you look, you see all the difference with that in.
I know for a fact you do that. I saw this one, a bodybuilder, he was like hanging up and
There's the people, it's a little slippery. Hey, notice, the vitreous humor came out with it in one big piece. Do you see that? Right, that's your vitreous humor, yes. Now, if you open this up
No,
more,
why does it look like an all?
yeah, you definitely gotta open it up more, but if you open it up more, let's see.
You have no idea.
I'm gonna let you deal with that, but you'll see the turquoise retina. It's very thin and it's usually beautiful. But if you don't cut properly, or sometimes you can't see and it doesn't turn out so good. Okay, no, you're good. Okay, Are you going to sit down right here? Okay. Okay. Now, no. If I may, please, right? No. Okay, here's the cornea, right? The cornea, yes, right? Aqueous. Aqueous is like water. It's thick, but it's like water. Yes. Okay. The front of the eye. You of course can see around the edge there. That's the iris, right? The colored part of the eye. Yes. And you can also see that's the lens right there. And if you get a hold of that with your tweezers, you may. The next table, they grab your tweezers and grab the lens and just gently. See it right there? Right? It's a big ball. I mean, it's way bigger than a BB. Yeah, there you go. Get a hold, get a hold. Now, very gently, because your vitreous humor is stuck to it. The other ladies, they pulled it out in one piece. The vitreous humor and the lens in one piece. It was kind of cool. Hey. Operation. Yeah, there you go. Yeah, it's a lens. See, this particular sheet, right? In one piece. Very nice. See? The lens and the vitreous humor. Note the vitreous humor, it's thick. It's like yellow. Yes? Right? And so now what we need to do is we need to make these deeper so we can open it up and you will see the retina, and it's maybe turquoise looking. It's usually a lot of times very beautiful. And if you take your tweezers very gently, you might get Mr. Surgeon over here, and a lot of times you can pull it off and lay it on a paper towel. Way cool. Right? But they're very brittle, they can tear up very easily. So, right? Yeah. But yeah, that's it. Let's see. Aqueous humor, vitreous humor, lens. The iris is right there. The cornea. There it is. The cornea is right there. Right? Yes. Okay. Wow. Wow. Okay. There we go. Right? Okay. There's your cornea. Right? There's your cornea. There's your lens. This clear stuff is a varnish. That is your aqueous humor. Aqueous for water, aqua. This is your vitreous humor stuff to your face. Yes. Okay. And the black is the choroid layer. And that right there, sometimes it comes out in a piece that's kind of shaped like this that wraps around the back of the eye. That is the retina right there. Yeah. Okay. See, somebody's supporting that. Really, really tricks you. Say that again. This one just put that in, because I want everybody else to see. Your aqueous humor, the vitreous humor, the lens, right? Right around the edge is the iris. Yes. Good. And when you open it up, you see that little green stone across there? Right. And you can see these ladies, they already got theirs out because now they're multiple. That's a pretty good job. Okay. Oh wow, isn't that nice? Wasn't
Don't you worry.
Yeah.
Put the jelly back.
Yeah.
I got it.
There we go, okay. Now, can you see all that blue green right there? That cool? Right, that's your retina, that's the back of the retina. What turquoise wraps around. You know,
That's the right.
that's a good question. I haven't done any human eyes.
What kind
Other
of
than
lens?
35 years ago, 40 years ago. But for the sheep, yes, it's almost always that. Sometimes it's a little more purplish. And sometimes it's a little more bluish. Yes. That is a good question. I do not know if it's because of the rods and cones.
What are you gonna do?
It is. Yeah, that's part of it. Yeah, see? Oh,
Yes.
nice. Yeah, let's see that. Good job, young lady. Good job. Okay. Can you see that though? And again, it doesn't coat the whole inside of the eyeball, just the back, around part of it, right?
Foils it.
Yes, because it's coming in like this.
Yeah, the yolk's kind of hard.
Yes, and the black is the choroid. The black, you can see it later there, is the choroid from the melanin. Remember melanin makes our skin brown, right?
Surgeon.
Within, here we go. Right? Right? You got your cornea. You got your aqueous humor. Aqueous, remember, in front of the eye, it's water. You got your vitreous humor right here. You got your lens right here. You got your retina right there. And you got the choroid layer back up in here. And
Why did you do that?
We should have used these big
hey ladies, y'all got it all down?
I think so.
Yes? Let's see. You didn't take it out? Aren't you gonna take it out? That's what I say, get a pair of tweezers and very gently see if you can. Oh, okay, you got right down the middle of it. Well, you can still try it. Hey, you can still try it. Okay. What do we got over here? Okay. Yeah, exactly. Yeah, and you know, where the optic nerve comes out to, it kind of wraps around that. Yeah. Yeah, okay, very nice. Right? Very nice, real pretty. And such. Amazing how hard the wall is.
I've seen the inside of your eye.
Amazing how hard the lens is, I should say. Right? Okay, but anyway, one more time. Aqueous humor, vitreous humor, lens, iris, the pupils of hold, the retina, and the black is the choroid layer, right? The choroid, the vascular layer with the melanin pigment, right? Okay, let me see. You guys are done. Let's see, just 1 second.
I have a question. Why is this so clean?
I'm thinking that's gonna be increase that Okay, okay, got a big chunk right here.
We put like shaving cream in it.
She gives us a notebook paper, we had to fold it like one of these cracks.
Again, like, see that right now?
Version of it, but then we had to put gloves in it and try to put it in. She had like that all over.
See that? See that retina? Yeah. That wraps around the back of the eye like that, right? Pardon me? Okay. Right. Okay, okay, let's clean up now, and I need all the biologic stuff in this trash can, okay? Because we're gonna go dump it immediately in there, and we're gonna spray the tables with 409 and wipe them down. And we're gonna dry all the tools before we put them in. Someone, could you open that for me? Thank you, sir. That's exactly what I need, right? Okay, yeah, big hands, wipe it off, thank you, yeah, yeah. See, just way to do it, I don't want a bunch of pieces of eyeball in the sink over there, that'd be kinda, it'd stink after a bit. Right? Better wash my face. Sorry, Sonia, you get the prize for the best retina, did you know that? You maybe should consider eye surgery, because you did that real well, young lady. Okay?
Okay, I got it.
Thank you. Good job.
Oh,
Okay. And again, inside each table, there's a roll of paper towels, and inside the fridge and the door is a 409. You gotta wipe all the tables down, and make sure you dry all the tools before you shut the kit. Right? Now, could I ask a favor? You guys can move down. Because what I'm going to do is, I'm going to roll these out, and we're going to lay the trays like we did the other day. Right?
That's just nice. We don't have to.
Have another roll.
Oh, yeah.
Thank you.
Okay, super. Thank you very much. Yeah, that's fine. Yeah, that's fine. I'm the trash man. Don't run me any towels. Great. You sit here. Like that, right? Yes? You never baked cookies before? Huh? Man, what's the matter? What's the matter with you? You never baked cookies when you were little. Does your mama love you? Yes?
Like to think so.
She didn't let you bake cookies somehow. Even I baked cookies when I was little, and I was 14. Thank you. Would you stop the video for me?
Yeah, I got
Where's the mouse?
Right,
Right, oh, right here.